Now, if you have understood what cognitive resonance and cognitive dissonance is, and what it kind of outcomes it has for yourself, then you should be asking, okay, I want to fill my learning gaps. I want to fulfill my learning needs. What should I do? How should I proceed? And here are the answers to that. First, you should be aware and careful, where can I have the questions? The clinical questions, the learning gaps for yourself, they can be from many sorts of conditions, like clinical findings if you examine a patient, like an etiology or risk factor for a disease, clinical manifestations of a disease, differential diagnosis coming into your mind or discussions, tests you have ordered and test results, hypotassium in a patient. What can it be? Is it kidney failure or is it just hemolysis? Can some other reasons be behind it, like using some medications, diuretics maybe? This all sources are points where you have to be careful to find your questions. Prognosis, therapy, we said, okay? So these four, therapy, prognosis, etiology, and harm. These four different conditions. Then prevention, experience of the meaning, and improvement, how to keep up to date, improve our clinical and other skills, and run a better, more efficient clinical care system. This all should help you to find your question. Once you have found your learning needs, you have your answerable clinical questions, then it is time to apply it, to learn. For this, there are three suggestions. One is capturing or saving. So you have to write it down somewhere. Make a list, make a learning list, then schedule it, make a plan for learning, and select, because we have many learning needs going parallel, and from these we have to prioritize some of them. Some are urgent learning needs, they have to come to the forefront. Some are important, some are urgent and important. So if a learning need is urgent and important, if tomorrow is an exam and the topic is very important, then of course you have to study tonight. But if the exam is later, after 1 month, it is not urgent, but it is still important topic. You are studying evidence-based medicine. You don't expect me to say physiology. And then, of course, you have to do it as well, but you can postpone it a little bit. So, capturing, the first step, capturing. Most of us are using smartphones now. I am capturing. I write down on my smartphone, on my diary. You may have also papers, or you may use this kind of prescription, educational prescription. You may prescribe yourself something to learn, and with this PICO, problem, intervention, outcome, and when you are going to study it, and keep it in your pocket, or hang it on somewhere where you will see it on the refrigerator, on your desk, somewhere. And scheduling, the third step, scheduling. We have to decide by when we need to have our questions answered. And as I said here, first things first. If it is urgent and important, of course, we have to do it immediately. depending on the urgency and importance, you select which question you have to target first and which comes later. So this is actually just some advice of using your time effectively. Same time. That was it for this presentation, for the asking answerable clinical question. What we discussed the background and foreground questions, the two types of questions, background and foreground. Background, we had two components, namely, do you remember them? If not, go back. Then the foreground, we had the four components plus sometimes TT. Okay, and we discussed today cognitive resonance, cognitive dissonance. So what it means, you can apply actually this knowledge to your also social life, daily life. So please try to learn what these terms mean. And the components of a well-built foreground clinical question, these four components, and the three strategies for practicing PBM. If you can master these objectives, these four objectives, then you can declare yourself as successful regarding today's session. Thanks for watching. Take care. Bye-bye.